Okay, we are here with a follow-up who looks fantastic. This is her before, and we have her after. So tell us, how have you been, how you been feeling, and what we're doing today.
I feel great. Today's just a follow-up, and I brought some pictures.
Okay, so we talked about you. Tell them what we talked about. Do you remember? I asked her to bring some pictures of herself a long time ago because last time, well, we can do it again. When you look at that picture, what do you see?
I see someone I don't recognize.
And what you meant by that was?
Well, my eyes, you can see there, they were extremely closed, and I didn't like it.
So she's going to share with us some pictures.
When my eyes were open.
I told her I didn't want to see them until time. Because I think that what we're going to see when we look at those pictures is you
The way I remember.
the way you used to be. Because a lot of people say that about aging, and then people are afraid they're going to look fake. But really, most people feel like they look more like themselves.
Right.
So she had a upper blepharoplasty, lower blepharoplasty. We took out little fat pads, and then basically a reduction rhinoplasty. And so let's compare. And that was, it's been
2 months.
2 months. 2 months ago. So she's still. Let me get some clothespins. Okay, so show me. I told her I didn't want to see them before because I want it to be real.
This is 1981. When I was a senior, and you can see that my eyes were still open there. I did need rhinoplasty even in the 12th grade, but I was waiting on Dr. Petro to grow up and become a doctor.
But your eyes are the focal point of your face. Like when y'all look at this, do you see eyes? Like what do you see? I mean, send me a thumbs up or something, a heart. But I mean, I see your eyes when I look at this picture. I see great skin and I see eyes. What do you see?
The same.
Okay.
This picture would be from the Southern Women's Show with Jack Devereaux from Days of Our Lives.
I love Days of Our Lives.
I knew that, so I brought it.
Oh, I love this.
So I was probably in my 20s there. That was sometime in 85.
This is 1985. That's great. Again, I see eyes. I mean, that is a recurring theme.
And this picture is when I was probably 31.
And is this your grandmother?
This was my mom, and that is my daughter, Taylor, when she was a year old.
Gosh, how old were you there?
31.
See, I think you look younger than that. Again, I see eyes. So this is how old?
Probably 17. It was 1981, and I'm 55 now.
And then this was?
I was about 25.
So we're basically about 10 years apart, right?
Mm-hmm. And then I was 31 there. And this one is 15 years ago, so I was 40 in this picture. This is my wedding. That's my husband, that was his best man.
How old were you here?
40.
So what you see here, we lose your eyes. Above everything else, we lose your eyes. So this is high school eyes. I think aging takes you away from yourself. I don't think that's what happened. I mean, this is 10 years difference, 30 to 40?
Yes, 9 years, actually.
That's when your eyes shut. And then this, how long were you here?
And this really, I mean, my eyes, I think, like in the last couple of years, really, like, sped up and just started closing. So now,
when you look at them, tell me what you think.
Now, just like I did back in 1981, right?
Your eyes really do. I mean, now when I look at your face, I see your eyes.
Yeah, I think so too.
And I think it's the light around your eyes that makes the difference.
Mm-hmm. Yeah, I'm much happier. And it's been a breeze. So if you're something you want to do, it's really been an easy surgery. The eye surgery has.
So when you wake up in the morning and you put on your makeup,
Oh, it's great. I mean, I don't, there's nothing I don't like about it. I mean, there's just nothing negative to say about getting it done. And I feel better about the way my eyes look. I love everything about it.
so when you think about it, do you feel more like yourself or
yes,
less like yourself?
No, more like myself.
And what kind of comments have you? I know we talked a lot about the comments, but
The comments mostly are positive, and any comments that I've had that were negative weren't about how I look. It's about, why are you getting plastic surgery? Those are the negative.
because people think you're going to look like somebody else. But hold up that picture one more time.
This one?
Mm-hmm. I mean, I think she looks more like herself and how she remembers herself there than she does here.
Yeah.
Do you feel that people respond to you any differently or more openly, or you're such an open person you really don't give people a chance to be cold? What did you tell them earlier? So one of my staff said, "Oh, your eyes look so good." What did you say? Lighter.
Oh no, Tish said that my eyes look lighter. I said, that's because they're not in the dark. You know, over here they're in the shade, so they look darker. So now they look lighter.
Do you feel like people respond to you differently at all?
I don't know really, because I haven't really been around anyone different. You know, it's just the same people, and they all knew what I was doing. So.
Has anybody said, "Wow, you look great. You don't look fake"?
Oh yeah, they do say that. Yeah, they all say that. Like, it looks great, you know. This guy in my office did say, I'm gonna have to get used to looking at you with these big eyes now. And so that's probably the only one who said anything. Because he didn't know me before. You know, he didn't know me in this picture. He only knew me with my eyes closed.
I think you look more like yourself, and thank you for bringing the pictures. And y'all send her some love, because that's great to send that, because I really think it shows who you are.
Yeah, I love it.
And I think it's good. I don't even want to call it plastic surgery. Gonna have to come up with another name, because that means to mold into something different, and I don't think that's what we're doing.
Yeah, no.
I think we're molding. We're just in. It's really turning back time.
Yeah, it's you. It's just a better version of you. It's you that you used to be.
And I think that's the number one thing, is you look in your mirror, or you look in at pictures of yourself, and you're used to knowing yourself that way for 45, 50 years, however long, and then you start to see things on your face that you don't recognize. That's what bothers people. I don't think it's looking old. I don't think it's a few lines. I think it's that you don't recognize what you see.
It's exactly that. It's like, I was looking in the mirror going, I don't recognize the person that I'm seeing in the mirror. I want to look like me. I don't want to look like somebody else. I just want to be able to look at my eyes and see my eyes. And to be able to see, like, I see so much better just having this surgery done. My vision is better. So, get it done, people.
Well, and your nose, I mean, I don't think your nose is your focal point, but it certainly looks, it's smaller than it was, and it simply looks, it doesn't interfere with your eyes anymore.
Right.
And to me, a rhinoplasty shouldn't be this tiny pointed little nose, and to most people it shouldn't, but it should just go with your face. And there you see nose, but you really don't see eyes. And here you see your eyes. And it's, you know, it's reduced, and it's only been 2 months, so we're doing better every day.
Yeah. I think it's very natural looking. I'm very pleased with it.
She has one more thing she wants to do, which we'll do next time. You want to show it to them?
I want this bump taken off.
It's a tiny little bump, and I'll laser it. She calls it her third eye.
Yeah, like a cyclops. I don't like it.
But it's not. But we'll laser it down, but she doesn't want to bruise. Anyway, I think you feel more like yourself. I mean, you look more like yourself, but I think you feel more like yourself. I think it's
definitely
the same thing. Everybody gets used to looking in our mirrors at home. But when you look at a picture of yourself, it's backwards. So even if the picture's good, it's never going to look like you, depending on the lighting, depending on the angles. But it's a reflection, so it's backwards of what you see. But I think the same thing happens with aging. So I think you take yourself back to where you were instead of looking like somebody else. And we're going to come up with another word for plastic surgery. Do you know what I mean?
I do
It's not
understand.
plastic surgery.
It's not, and it's not a bad thing either. So stop hating people.
Yeah, stop hating. Don't be a hater. I'll send Taylor Swift after you. All right. Well, thank you, Kim. Do y'all have any thoughts or any questions for her that she might answer? I'm happy to ask her them. Again, she feels herself. She's a beautiful woman. She looks great. Great job.
Aw.
Thank you. What else? Does anybody have any questions? Joanna Garcia sent a haha, Jen. What'd you do?
It got stuck zoomed in and I double clicked trying to zoom out and it flashed to me real fast.
Hey, Jen's here doing spray tans today if anybody needs to be sprayed. Anyway, I think you look great and I think the focus is perfect in how you look. And I love you for bringing those pictures. Just, that makes me so happy. Can I scan them and show the timeline? This is the thing about them is, I mean, and these are roughly 10 years apart. I mean, this looks more like her now. And you don't want to look like somebody else. I love this. And I have a picture with Mike Tramp, lead singer White Line. I was determined to kiss him.
I would give anything for that hair again.
I know. What if you'd been with the Days of Our Eyes person? I forgot. Well, travel in her shoes. I don't know if y'all know her, but she consciously uncoupled. Did you see this on Instagram?
I saw your post about it.
She consciously uncoupled. It's like the modern word for divorce. I wonder if it's cheaper. Anyway, if you consciously uncouple, you're just not with them. I don't know, it made me sad. And they're real people. And they've been together for 5 years. You wake up and find them on Instagram. And we're either, I mean, she showed me the most beautiful places in the world, place I've never seen. Greece. She goes everywhere. Poland. I mean, I wouldn't, anyway. And they're happy and friends about it, which is weird and so on Instagram. Like, I'd almost rather be mad at each other because I feel like they'll go back together. But it's sad, and we really like him. I mean, he takes great pictures like her. But it reminded me of, you wonder where I'm going with this? I'm going somewhere for all of you haters out there. Lily and Holden, you know, As the World Turns, did you ever watch them? That was my show. And my sister says she didn't like watching it with me, but I know she did. But I would get so upset, and then she'd go in her room and watch it because she didn't want to. But I was very attached to Lily and Holden. At least these people are real. But then they took As the World Turns off the air. I used to like sneak into the library at Jackson Prep to watch it from 1 to 2. So I love soap operas.
Yeah, I love Days of Our Lives.
First day of medical school, they said, "What do you want to be?" "I'm going to be a doctor on a soap opera." I wonder why they didn't like me. But it didn't dawn on me that wasn't what everyone wanted to be. But I wanted to bring more reality to soap operas. I wanted them to be more medical so that when they're laying there dying, if they have a tube in, they're not talking. Like, I just thought it should be. I still want to do that. But they don't even make soap operas anymore. Do they?
I know. I think
Bold and Beautiful.
Days of Our Lives is still on.
I had to quit watching Bold and Beautiful when Bridge and Rook. That was too much for me, that breakup. So, today we are praying for Travel in Her Shoes and Selena Gomez and everybody that's suffering that is real and unreal. Olin Mills.
I know. It's probably one of the last pictures.
Look at this, though. Like, look what else this says about the world. Like, how have pictures changed?
Mm-hmm.
How they've gotten so much more real. They really have. But you look beautiful there.
Thank you.
I'd love to see a picture of your mother now.
Now?
Like, can we do that next one? We'll bring your mother. She might not like it.
She's no longer with us. I can bring pictures. Some old pictures.
It's fun. Aging doesn't have to be. It's not. People talk about the textbook things that happen, but so much of it is genetic. And when you study people and their families, I mean, there's so many people that say, men and women, I don't want to look like my mother. And then they feel men have no guilt. But women tend to feel so guilty when they say it. And they'll say, I feel like I have my mother's neck. And I love my mother, but I don't want her neck. and that's how people associate aging, is how they're, and it really is more about your family than how a book is. And when you see generations together, you can really see what it does. And I do think it takes you further and further away from what you're used to remembering, which is also, you know, people wrote on that post I was telling you about how vain I am and all this is, and it's never about people. There are crazy people everywhere, but it's never about people wanting to look like someone else. It's about people wanting to look like how they remember themselves. And it's disruptive to your mind to wake up, and it interrupts your thoughts throughout the day when you look in the mirror and you don't recognize yourself. And it's like, you know, people say when you're down, go do something you used to love. Like, I love to swing. I have a swing in my room now. Get on my swing, please don't say anything gross. And I swing because I like to swing. Or, you know, they're just different things that you did. I used to love to read, and I quit reading for a while, and I'm starting again. Like, it's like things, when you do things you used to love, you feel more like yourself. But when you don't look like yourself to yourself, it's distracting. It really has nothing to do with the world. It's not Snapchat's fault. It's not filters' fault. It's not Facebook's fault. It's that you see yourself in a certain way, and when that changes, that's what bothers people. And I feel like that part of the story, there's all this Snapchat dysmorphia talk, and that filters are making people wish they were something else. I just disagree. No one wants to look like someone else, even if that someone else looks better. They just want to look like the familiarity and the consistency and the certainty with how they look.
And I think it's healthy, like, for you to feel good about how you look. You know, it's not just, I don't mind getting older. I just want to recognize myself when I look in the mirror. I don't mind the wrinkles so much, but feeling good about the way you're aging and the way you look, I think mentally is healthy. So it's good for your health.
And it's Mental Health Day.
It's good for your health to get plastic surgery, people.
But we're going to come up with a new name for it. You're
Yeah.
going to help me.
Okay.
It's like back to yourself surgery, but that's too long. Okay.
Yeah.
Well, don't consciously uncouple today.
It's not a bad thing.
Have a good day. No more loss.